Welcome to NeuroSolutions, where we explore how AI can enhance clinical reasoning, support medical education, and improve day-to-day productivity in healthcare. In this video, we introduce Glass Health, an AI-powered clinical decision support tool, and show how it performs on a simulated chest pain case. We'll move step by step, from differential diagnosis to diagnostic workup and treatment, and finally to long-term risk management. This video is provided for educational purposes only. It should not be interpreted as medical advice. Glass Health is designed for licensed clinicians, and trainees should use it only under appropriate supervision. Always adhere to institutional policies and consult qualified professionals when making clinical decisions. Glass Health is an AI-powered clinical decision support platform. It helps structure the differential diagnosis, draft the assessment and plan, and support documentation such as history and physicals and progress notes. In enterprise settings, it can also integrate directly into the electronic health record. Glass Health takes the symptoms, history, and findings you enter and runs them through its clinical reasoning engine. It then generates a structured differential and a draft assessment and plan, which you can review and adapt to the patient. To begin this case, we enter the key details into Glass Health. This includes acute chest pain with concerning features, associated symptoms such as diaphoresis, risk factors like diabetes and hyperlipidemia, and the ECG findings, including hyperacute T waves without ST elevation. Glass Health organizes the differential diagnosis into 3 layers. First, the most likely diagnoses. Second, an expanded differential. And third, the can't-miss, high-risk conditions. This structure balances probability with clinical risk. In this case, Glass Health prioritizes non-ST elevation myocardial infarction, an NSTEMI, based on the hyperacute T waves and the patient's high-risk history. Unstable angina is also included, capturing ischemia without biomarker elevation. Glass Health highlights the can't-miss causes of chest pain, such as aortic dissection, pulmonary embolism, and tension pneumothorax. These appear early in the list, so clinicians are prompted to rule them out promptly. Glass Health also broadens the frame with an expanded differential. This includes STEMI equivalents, Takotsubo cardiomyopathy, and type 2 myocardial infarction from supply-demand mismatch. This keeps diagnostic thinking comprehensive yet prioritized. For the diagnostic workup, Glass Health emphasizes several key steps. These include serial ECGs to monitor for evolving ischemia, high-sensitivity troponins, and a chest X-ray to evaluate for alternative causes. When indicated, it also suggests point-of-care echocardiography, or CT angiography, to assess for aortic dissection or pulmonary embolism. Glass Health synthesizes the patient information into a structured assessment, highlighting high-risk acute coronary syndrome, most likely NSTEMI or unstable angina. The risk factors and ECG changes underscore the need for urgent evaluation for ischemia. For suspected acute coronary syndrome, Glass Health recommends several key diagnostics. These include serial troponins, serial ECGs, basic labs, and coagulation studies, and a lipid panel, supporting both the acute evaluation and the long-term assessment of cardiovascular risk. Glass Health also incorporates metabolic risk into the workup. Diabetes increases the risk of acute coronary syndrome and may blunt typical symptoms, so it recommends close glucose monitoring and obtaining a recent HbA1c. It also reinforces checking a fasting lipid panel within the first 24 hours of admission. Glass Health outlines guideline-based therapy for acute coronary syndrome. This includes a 325 mg aspirin load, followed by 81 mg daily, atorvastatin 80 mg as a high-intensity statin, a beta blocker if the patient is hemodynamically stable, anticoagulation with heparin, and urgent cardiology consultation to plan an appropriate invasive strategy. Glass Health aligns metabolic care with the management of acute coronary syndrome. It recommends targeting glucose levels between 140 and 180 during acute illness, resuming or adjusting home diabetes therapy once the patient is stable, and continuing high-intensity statin therapy to support long-term cardiovascular risk reduction. Glass Health extends the treatment plan beyond the hospitalization. It recommends optimizing long-term glycemic control, maintaining high-intensity statin therapy, and coordinating primary care and cardiology follow-up to reduce the risk of recurrent events. Glass Health grounds its recommendations in real, peer-reviewed evidence. Each reference links directly to the actual guideline or study, including the AROMI myocardial infarction rule-out trial and the AHA-ACC guidelines for non-ST elevation acute coronary syndromes. Users can click on each reference to access the source and read the full text for deeper study. This level of transparency helps avoid issues seen with large language models, such as hallucinated references, and allows clinicians to verify the evidence themselves. Glass Health also includes a broader support ecosystem. It offers consult-style question and answer support, automated drafts of the history and physical and progress notes, and patient handouts, along with a deep reasoning mode that explains its step-by-step thinking. For enterprise users, it adds ambient scribing and seamless electronic health record integration to support a smoother clinical workflow. In summary, Glass Health structures the differential with clear clinical reasoning, generates guideline-aligned assessments and plans, integrates metabolic risk factors, and provides documentation ready for electronic medical record workflows, all supported by transparent, evidence-based citations. Thanks for watching. Subscribe for more deep dives into AI in medicine, and let us know what AI tools, apps, or workflows you'd like to see reviewed in future videos.